Non-nutrient components of our food are those that have no nutritional value at all, and they contain little to no calories. The first thing that came to my mind when I heard about them was artificial sweeteners, because that's exactly what those are. But that is not what I am talking about here. Today, we are talking about one non-nutritive component that can lower your cholesterol, your blood sugar, and help fight cancer. 3 things I am currently working on. Welcome back to my channel. I'm Rachel. I am a 2-time breast cancer survivor who is here to share what I have learned throughout my journey about life and happiness and nutrition. I was first diagnosed in 2017 and then again in 2020. So I've got a pretty vested interest in staying as strong and healthy as I can, physically and mentally. Now, we all know that we want a nutrient-filled diet. So common sense is going to tell us that we want to avoid non-nutritive foods, right? Not necessarily. There are some non-nutritive foods that play a vital role in our bodies, and it's essential that our diets include them. Case in point, fiber. Yep, fiber is considered a non-nutrient because it is not absorbed by the body. It's found only in plant foods. It's the part of the plant that is not digested in the small intestine, and it reaches the large intestine basically intact. There are 2 basic types of fiber, insoluble and soluble, but hopefully you already know this, so I will be brief here. Insoluble fiber adds bulk and keeps things moving along. It's like a broom that sweeps through the digestive tract. It does not dissolve in water. It's roughage, which is what most of us think about when we think of fiber. Think whole grains, nuts, seeds, the skin of your fruits and veggies, lettuce. Soluble fiber attracts water and it turns to gel during digestion. Think about if you've ever made chia seed pudding, or think how thick and gooey oatmeal gets when you add liquid. That is soluble fiber. Soluble fiber is prebiotic, which means that it feeds our gut bacteria. Things like chia and flax seeds, sweet potatoes, oats, asparagus, apples, beans, avocados, broccoli, just to name a few. So if you are eliminating a lot of those foods from your diet, the odds are good you aren't getting enough fiber. U.S. recommendations are that women get a minimum of 25 grams of fiber a day and men get a minimum of 38 grams. But if you're over 50, they say you don't need as much. 21 grams for women and 30 grams for men. Personally, I get around 25 to 30 grams almost every day. And that is on a relatively low carb, high protein, whole food diet. Because anywhere from 60 to 90% of the American diet comes from ultra processed foods, it's estimated that 97% of Americans do not get an adequate amount of fiber, because the majority of those foods contain very little of it. Now, there are a lot of people who do okay with little or no fiber. And if that's you, fantastic, more power to you. I am glad it's working for you. And I know that some of the fibrous or prebiotic foods cause issues for some people and are best avoided by them. For me, however, because of my breast cancer history and with what my meds have done to my cholesterol and blood sugar levels, my focus is on my gut microbiome, my gut health. And that requires building a healthy microbiome full of diverse bacteria. And how do you do that? Fiber. I have researched out the wazoo the benefits of damn near every diet out there. And I have tried a lot of them. I am not telling you that you have to do what I do. I am telling you what's working for me and makes me feel good. And I'm going to show you some research studies to back it up. Now, I know every single person who advocates for a certain diet can find a study to back up their beliefs. One thing I do find interesting is there are a lot of influencers out there with millions of followers who a few years ago were saying that you don't need fiber, but they have since changed their minds. Not all of them, but there's a few. I also know that not every diet works for everybody. I am not here to judge anyone or argue with you over food. And I am not telling you that you have to eat only plants. Yes, I eat a lot of them, but I also eat red meat, poultry, pork, seafood, eggs. My diet focuses on protein and fiber. It's whole, minimally processed foods, probably 90% of the time. So what is it about fiber that helps with cholesterol and blood sugar and breast and other cancers? Well, again, most of us just think of fiber as a way to stay regular and to clean out the pipes, if you will. And it does do that, but it's not all it does. We need both kinds of fiber, and there are a lot of foods that provide some of both. But in my opinion, soluble fiber is the superstar here. It is the fact that it easily dissolves in water and breaks down into that thick and viscous gel when it reaches the colon that makes it a star. It feeds and nourishes our gut bacteria and produces short-chain fatty acids, which boost our gut health. Now, when it comes to lowering cholesterol, the lowering effects are mostly on LDL, or bad cholesterol. Soluble fiber lowers our LDL by binding to it in the small intestine. Now, once that fiber is in the small intestine, that viscous gel attaches to the cholesterol particles and prevents your body from reabsorbing them into your bloodstream. Instead, that binded cholesterol gets excreted from your body in your stool. You poop it out. Also, because that fiber is being fermented in our colon, it's feeding and nourishing our gut bacteria and producing those short-chain fatty acids. Those fatty acids get absorbed into the system when they reach the liver. They inhibit the activity of the key enzyme responsible for cholesterol synthesis. Animal and human studies have shown that those short-chain fatty acids do reduce triglycerides as well as cholesterol levels, and they do this a few ways. Besides inhibiting synthesis in the liver, short-chain fatty acids redistribute that cholesterol from the plasma to the liver, and they interfere with cholesterol absorption. In terms of diabetes and blood sugar, that viscous soluble fiber in particular slows down the emptying of the stomach and the absorption of glucose from the digestive system into the bloodstream, which is going to help you prevent blood sugar spikes after eating. Then the glucose is released more gradually, giving you more blood sugar control. And high fiber diets are associated with improved insulin sensitivity. Insulin is a hormone that helps you to regulate your blood sugar by facilitating glucose uptake into the cells. When the cells become resistant to the effects of insulin, blood sugar levels start to rise. Fiber makes it easier for cells to respond to insulin and regulate blood sugar. And finally, fiber-rich foods are just more satiating, and they help you control hunger. So you eat less, which can contribute to weight management and thereby reduces the risk of type 2 diabetes. When it comes to cancer, we all know that fiber helps to prevent colon and other GI tract cancers. But studies have shown that it offers protective effects against female-specific cancers like breast, endometrial, and ovarian cancers, as well as pancreatic, prostate, and renal cell cancers. Of course, my focus is on breast cancer, so that's what we're talking about. In 2012, there was a study published in the Annals of Oncology, funded by the World Cancer Research Fund, that found that for every 10 grams of fiber consumed daily, the risk of breast cancer was lowered by 5%. So eating 20 grams of fiber daily would mean a 10% lower risk, and so on. When the study compared the women who ate the most fiber to those who ate the least, women who consumed the highest amounts of fiber had a 7% lower risk of breast cancer. In 2016, Harvard released a study showing that women who ate more high-fiber food in early adulthood had a 12 to 19% lower risk of developing breast cancer. High fiber intake during adolescence was also associated with a 16% lower risk of overall breast cancer and a 4% lower risk of breast cancer before menopause. In 2020, a meta-analysis was conducted by researchers at the Harvard T.H. Chan School of Public Health. The study pulled data from 20 previous studies and found that women who consumed the highest amounts of fiber were 8% less likely to develop breast cancer than those who consumed the least amount. I realize that doesn't sound like a lot, but what I find significant is that this just gives further evidence that modifiable lifestyle factors like our diet affect our breast cancer risk. And knowing what I know now and having been through what I have, all I can say is every little bit helps. So, how can dietary fiber reduce breast cancer risk? Well, most breast cancer in the US, mine included, is estrogen receptor positive, meaning estrogen fuels its growth. Studies suggest that viscous gel, insoluble fiber, binds to estrogen the same way it binds to cholesterol, so that excess estrogen is excreted rather than reabsorbed by the body. I go into this in a lot more detail in my gut health video, which I will link at the end of this video if you haven't seen it, or if you want to refresh yourself. Plus, by feeding our gut, fiber may help to reduce chronic, low-grade inflammation and insulin resistance in the body, which has been linked to the development of all sorts of chronic diseases like cancer, diabetes, and heart disease. The bottom line is fiber is more than just roughage, and it does more for us than just keep us regular. I know there are a lot of people who can benefit from a low-fiber diet as well. People with inflammatory bowel disease, ulcerative colitis, and things like that. But I would also argue that those same people would likely benefit from getting their system calmed down, then slowly reintroducing fiber back into their diets for the prebiotic benefits and to help rebuild a healthy gut microbiome. By reintroducing the fiber slowly, you can figure out which foods bother you and which ones you can tolerate. I know a lot of people too who avoid fiber because they say it makes them gassy and bloated and constipates them, or the opposite. So there's a few fixes for that too, especially if you do not eat much fiber to start with. First, increase your fiber intake slowly, and I am talking a few grams a day. If you aren't eating much fiber, start by just adding an apple with some nut butter every day for a few days. Then up the intake a little bit more so your gut gets accustomed to the increase. By doing that slow introduction, again, you are figuring out which foods you can tolerate and which ones you can't. Number 2, drink plenty of water. Water keeps things moving and helps fiber pass through your intestines. You really cannot skip this step. If you already drink water during the day, I guarantee you that you're going to need to up it if you add more fiber. Number 3, spread it out throughout the day. Do not just suddenly eat 10 to 15 grams of fiber at every meal if you have not been doing that. Number 4, if you're worried about the gassy effects, in the short term, start low and use simethicone, a very mild over-the-counter anti-gas medication as you need it. Your body and your gut are going to get used to the fiber, and eventually that gas will go away. Number 5, move more. Start or end the day with a walk or yoga or something. Take a quick walk after a meal to keep things moving along. Your gut benefits from exercise just like the rest of your body. Number 6, if your diet includes a lot of processed foods, or for some other reason your gut health isn't optimal, take a good probiotic if you don't already. A good probiotic is going to increase that good bacteria in your gut that will feed off the prebiotic fiber that you're eating. Number 7, if you're experiencing diarrhea, pay attention to the type of fiber you're eating. Insoluble fiber can increase the rate of food passing through your digestive tract, and soluble fiber can decrease it. Remember, soluble fiber soaks up water in the digestive tract, making your stool firmer and slower to pass. Adding fiber to your diet offers so many benefits beyond just preventing or relieving constipation. Just to reiterate the benefits, adequate fiber intake has been linked to heart health by lowering LDL cholesterol, blood sugar control, and by default, a reduced risk of diabetes, cancer prevention, weight management, a healthy gut microbiome, which in turn leads to inflammation reduction. Honestly, before I started researching, I thought fiber was always just a means to keep me regular, and I would eat a salad with dinner, sometimes at lunch, and I thought I was good. But now I feel better eating less salad and more of the other veggies and plant foods. No matter what kind of diet you choose, whether it's low carb or keto or Mediterranean, paleo, adding fiber is only going to benefit you. That's it. That's all I've got for today. If you want to watch my gut health video, I will list that right here. Please give the video a thumbs up if you found it helpful, and subscribe to the channel. Both will help me out a lot, and I would be really grateful. Comment down below and let me know if you eat much fiber, if you think you do better without it. Thank you for watching today. I will talk to you in the next video. Take care of you. See you soon.